slides with everyone, and then we're going to get started. We have a full agenda. We hope to move through it quickly to leave time for you to lift up some of your questions. I know that we have a very large group, and so I want to invite you to share your questions in the chat as they come up for you. Likely, we will not have a chance to respond to all of them directly, but this team, NACHW and Morehouse and CERN Project, will gather these questions and send not only the questions, but all of the slides that you're seeing today out to all of the registrants. So again, feel free to use the chat liberally, and know that if we do read your question or get to your question, please just charge it to the time constraints, and we will do our due diligence. As well, you're going to see in the slide deck emails and ways to reach out to the NACHW team and the Morehouse team if you want to jot those down during the presentation. If you have urgent requests, please feel free to do that as well. I'd just like to give a moment opening. Yes, hello to everyone. I know so many folks are putting this through the chat. My name is Sylvia Smith. I'm a community health worker, a patient navigator, and a survivor of a rare chronic disease. I have the honor of being the founding executive director of the National Association of Community Health Workers. As you come on, and let's remind our brothers and sisters to mute yourself in the chat so that everyone is able to engage well. Since the first US diagnosis in January of this year, COVID-19, a coronavirus with nearly 5 times the death rate as influenza, has impacted the physical, mental, and economic well-being of the general US population, with particularly painful assaults on our elders, frontline and essential workers, low-income residents and rural communities, and people without safe and affordable housing or access to healthcare. At last count, as I was writing my thoughts last night, more than 17 million Americans were infected and over 310,000 had died in the US from COVID-19. COVID-19's disproportionate harm on persons who experience historic vulnerabilities, Indigenous tribal members, Black, Latinx, Asian American, Pacific Islander, Hawaiian, and Alaska Native populations should be considered in the context of a failure to coordinate national strategies, strengthen our public health infrastructure, and invest in community organizations, and the denial of the impact that systemic racism would have on infection rates and death, confidence in health systems and messaging, and access to resources needed to protect human life. America is not yet collectively affirming and prioritizing the dignity and worth of all human beings. So the way forward must be built with community knowledge, voices, and in authentic partnership. Hope in the power of widespread vaccine distribution and uptake brings to us a challenge and an opportunity to change our idea of what is normal, to invest resources, build trust, and expand access to ensure equity. And that's why we're here today. Equity can also be expressed as justice, ensuring fair treatment, access, and opportunity for advancement and outcomes for all individuals and communities. Equity and social justice are central values of the National Association of Community Health Workers. Our membership organization has a mission to unite community health workers, including promotoras de salud and community health representatives across geography, sector, and ethnicity, to support communities to achieve health, equity, and social justice. As we look forward to 2021, we know that we must lead with our values of equity and social justice when establishing and sustaining strategic partnerships to defeat COVID-19 and ensure equitable vaccine distribution. And a key partner in this work for NACHW is the Morehouse School of Medicine National COVID-19 Resiliency Network. Their multi-year initiative is going to develop strategies and tools in partnership with local and national organizations to mitigate the impact of COVID-19 on communities that experience vulnerability. And with those comments, I just want to welcome you to the call this afternoon. And I want to honor and acknowledge all that you have experienced over this past year since the first diagnosis in January, that your family and that your community has experienced. And I want to thank you for pressing into this call. And next slide, please. So here's our agenda for today. I've given my welcome and my call to action, acknowledging that we are all here to drive equity and social justice. You're going to hear today from our partners at the Morehouse School of Medicine National COVID-19 Resiliency Network. You'll hear about the mobilization strategy and how community health workers are key to that aim in their multi-year initiative. And then I will come back and speak a little bit more about our partnership with Morehouse, ways in which we are supporting them and ways in which we hope to continue to support our members and gain new allies and partners in this initiative. The Morehouse School of Medicine will also share with you other aspects and opportunities for engagement because there's a lot happening out of Morehouse. So we want to make sure you know that. And of course, as I mentioned, there will be time for questions. Please begin to throw those into the chat and know that we will call on a few folks as you raise your hand during the webinar. Next slide, please. Thank you. Next slide. Is Brittany Bethia with us from Morehouse?
Yes.
Welcome, Brittany. Thank you so much for joining us on the webinar.
Thank you. Thank you for having us. Well, today I'll basically be giving an overview of the National COVID-19 Resiliency Network to you all, specifically to highlight what our specific goal is and our 6 program objectives. I'll also just briefly highlight and describe what our initial target populations of focus will be, and then walk you through kind of key pillars to this work where we're focused on developing culturally and linguistically appropriate messages and materials, developing new web and mobile technologies to link communities to services and care, as well as our partnerships with many organizations at a national, regional, and local level to conduct outreach and dissemination to community members. Then I'll just wrap up briefly with our approach with our health equity lens, and then turn it back over to the National Association for Community Health Workers. Next slide. So our overarching goal is much like many other organizations. We are aiming to mitigate the negative impact of COVID-19 on vulnerable communities. This work is supported in whole by a $40 million award from the United States Department of Human and Health Services, specifically the Office of Minority Health. They have an initiative called the National Infrastructure for Mitigating the Impact of COVID-19 within racial and ethnic minority communities, and this is where the National COVID-19 Resiliency Network fits within. Next slide. So these are our 6 program objectives. Really, the first is to identify and engage communities. And so we know that there are specific communities by racial and ethnic group that are disproportionately impacted by the COVID-19 pandemic. And so those are the communities that we would like to engage so that we can develop resources and connect them to services that will help mitigate the impact of the pandemic on their lives. The way that we're trying to engage communities communities, though, is to first utilize our existing partnerships, but also develop new partnerships with organizations and individuals who are on the ground, like community health workers, who have those trusted relationships with community individuals, so that we can have an active dissemination network. So we're really talking about making sure that when there's new information available, that we can actively activate all of our partnerships to disseminate new information to those who need it most. We're also working to partner with organizations alongside our partners at the University of South Florida and ICF Next to develop culturally and linguistically appropriate information, with the knowledge that there's a lot of materials that exist right now that are in English or in Spanish, but maybe not in other languages for other individuals, or they don't have a cultural lens applied to the information and how it's presented. And so we're trying to collaborate with organizations to improve messages and materials so that they're more culturally appropriate. This program objective at the bottom is basically connected to how we're trying to leverage new technologies that we're building with our partners at KPMG to link resources and services to individuals and organizations. So these are solutions that we're trying to make available to individuals like community health workers, so that you can better help your patients navigate where they can find resources, not only related to COVID-19, but the other social determinants of health. So if they need access to transportation resources or mental health, the long list goes on, and you all know best what those types of resources are that individuals really need outside of what's happening around the pandemic. And then lastly, we're hoping that through our partnerships, we can really monitor our activities and understand what's working successfully, so that we can share that with other organizations, share that with our funder, and really learn what are those best practices that can be replicated across the country. Next slide. Next slide. So these are just a snapshot of the, So first I did want to emphasize that we do have specific geographic areas that we're focusing on initially, just because that was where certain areas were experiencing the most COVID-19 cases, deaths, and hospitalizations, but that this is a national network. And so our aim is to touch every state, territory, and tribe. And then this is a list of all of the populations that we're focusing on. So they include Asian Americans, Hispanics, African Americans, Native Hawaiians, and other Pacific Islanders, as well as Alaska Natives and Native Indians. Next slide. And so the process that we are kind of taking, or the framework to the work around the development of new messages and materials, is called community-based prevention marketing. And it really just means that we would like to engage organizations, again, who work at the grassroots level in communities, as well as individuals like yourselves, alongside the process of developing new messages and materials. Given that you all have insights that are really important and different from the insights that other types of organizations or individuals might have because of your day-to-day interaction with patients. And so this is just a snapshot of the process overall. In the new year, we're going to kick off some key informant interviews. For example, we'll be speaking with the National Association for Community Health Workers to get insights on what some of the challenges have been for community health workers in providing information to communities. And then also, we're going to be asking for their help to provide opportunities for community health workers like yourself to participate in some focus groups where we'll share different concepts or messages and materials that we're thinking would resonate with the community, but get feedback from you based on your experience. Then we'll pilot those messages and materials and make refinements based on some of the findings that we have or feedback that we receive. Next slide. Next slide. Thank you. So we do have our website that's currently on the internet. So it is accessible right now. It's www.msm.edu/NCRN. So we right now have been focusing specifically on getting people connected to the network. And we've been asking that people subscribe so that you can get new information as soon as it hits. So a lot of times we get information from our funder at OMH or our partners at CDC and NIH. And so we're trying to make sure that there's kind of a one-stop shop for you to access all of that information. And then we're also in the process of providing some different features on the site that we're working on right now. But this is just a snapshot of what some of those functionalities will be. I think that from the community health worker perspective, you can think of this as a tool for you. If you have members or patients where they're asking you for different resources in their area, the tool will allow you to search for those different types of resources by address or even zip code. Next slide. So these types of resources, again, they may be related to COVID-19, so specifically around testing or vaccine trials or vaccine centers, but also they can be related to other types of services or resources. So like mental health or social service organizations that offer different services, pharmacies or new health centers. And the aim is to make sure that there's up-to-date information that's really at your fingertips to help you guide community members. Next slide. So ultimately, we're trying to make it as easy as possible or as seamless as possible for someone to see what types of resources are nearby, especially for those, for example, who may have transportation barriers, making sure that if they leave one health facility, for example, they know where a pharmacy is down the street where they could fill their prescription, trying to help improve the navigation of different services at once. Next slide. Some other features that we're trying to offer is just making sure that you have an understanding too of what's going on in the area in terms of risk. And so again, keeping kind of a pulse on the number of cases, deaths, and hospitalizations in that area, as well as any other information that might be of use to you to keep a pulse on what's going on. This slide just kind of reiterates our approach at the National Center for Primary Care for how we prioritize health equity beyond just trying to target health disparities. And so the process is really engaging members of the community like yourself, acting on the data that we have available to develop programs, and then to learn and improve from what our efforts are. Next slide. These are just a couple of our publications from Morehouse School of Medicine, where we have really focused on African Americans, but many of our partners who are a part of the network represent all of the different racial and ethnic groups that we're focused on, in addition to other communities, so those who live in rural areas, individuals with disabilities, as well as those who are justice involved. And so becoming a part of the network really gives you access to not just those at Morehouse School of Medicine who may be able to provide a different perspective around the pandemic, but those other individuals and organizations who are in the network. Next slide. This is just a snapshot of the Morehouse School of Medicine team. We're led by Dr. Valerie Montgomery Rice as our president, and Dr. Mack is our director of the National Center for Primary Care and the National COVID-19 Resiliency Network. And I think we have a few members of our team who are on the line today too. So looking ahead and behind us, we just had our soft launch in October, and really what we've been focusing on is to onboard our partner organizations. In December this month, we actually had a national webinar where some of our partners presented some of their efforts in the first few months of the grant, such as Nora Hernandez. She's on the line from the University of Texas at El Paso. And then in the new year, what we're focusing on again is really launching this next iteration of our website and that technology that will help link community members to services and care. Next slide. So I know that I presented a lot of information, but overall, if we could go back one slide, please. Thank you. What we want you to remember is that the network is a resource for you to help you communicate with members of the community, but then also connect with other community health workers and others who you may not necessarily collaborate with in your day-to-day work. And so the network is comprised of community health workers, researchers, healthcare providers, as well as public health administrators and social service leads in organizations across the country, as well as territories and tribes. Another key component is that our governance structure is really around our National Advisory Board, as well as we'll be creating a coalition of community member organizations and regional work groups to foster facilitation of collaborations. Next slide. And I believe that's it. I think we can put up the contact slide. We do encourage you to, as I mentioned, visit our website to subscribe to join the network. And this is where you'll receive more information about updates along the months that are ahead of us. And our social media accounts are also listed there to follow to stay updated as well. Thank you.
Okay, so I'll jump right in. Hi, I'm Arletha Livingston. I'm from Morehouse School of Medicine. I am the intern CHW strategy person, and I'm also an assistant professor of family medicine. So just to talk a little bit about the community health worker mobilization. As we all know, community health worker involvement is critical to any COVID-19 mitigation strategy. And as such, is central, as Ms. Pathia was talking about, to the INSERN response strategy. So working in conjunction with NACHW as our strategic partner, the INSERN mobilization strategy consists of 3 overlapping phases. So there's the information gathering and planning. So the NACHW team has completed an environmental scan and listening sessions to understand the national CHW COVID response landscape. NACHW will provide a high-level overview of the results later in this webinar. I will highlight the mobilization, evaluation, and research phases. So next slide, please. The mobilization strategy fits into the INSERN COVID response goals of nurturing existing and developing partnerships, disseminating culturally and linguistically appropriate information, linking communities to resources with technology, and soliciting and incorporating feedback from communities. So the mobilization strategy involves the hiring and training of CHWs. NACHW is in the process of advertising for CHWs in specific hotspot locations. These CHWs will have already completed CHW core competency training and will receive additional INSERN and COVID-19 information training, as well as dissemination training. The higher CHWs will be involved in community engagement through NACHW and the INSERN Community Coalition Board. They will be involved in advising and providing feedback on strategies and materials, disseminating culturally and linguistically appropriate information, engaging with other CHW community members and organizations in their focus areas, recruiting community members for focus groups and surveys, and distributing Comcast broadband connectivity vouchers to community members as needed. The CHWs will be involved in INSERN evaluation and research. They'll be facilitating focus groups with members of target stakeholder communities to determine culturally and linguistic appropriateness of materials and tools. They'll be participating in listening sessions with the Community Coalition Board conducted every 6 months to ground truth the state of public health infrastructure response among disproportionately impacted communities. They will also be entering outreach and linkage to care information in the KPMG platform. Next slide, please. As far as community response capacity building is concerned, community-based organizations are in a unique position to make a great impact on COVID-19 mitigation strategies. So in the Community Bridges program, NSERM will support 15 to 20 local community-based organizations in COVID-19 hotspot areas with capacity building, training, and technical assistance to support the mobilization of community health workers in local areas. So applications from CBOs in particular areas will be prioritized. Selected CBOs will receive training and technical assistance to develop CHW mobilization plans, and that technical assistance and training will include monthly webinars, access to online CHW training, both adult training and youth training through our high school and young adults community health workers training program. They will receive technical assistance calls, mobilization plan, implementation, and evaluation assistance, a stipend, and additional Comcast broadband connectivity vouchers. The application portal will open on January 4th and close on January 31st, 2021. Next slide, please. I also want to highlight two additional related efforts MSM is engaged in, headed by Dr. Tabia Akintobi and Dr. Raquel Quarles. The NIH Community Engagement Alliance, SEAL, against COVID-19 focuses on addressing misinformation around COVID-19, including vaccines, engaging trusted partners and messengers in the delivery of accurate information, and educating communities on the importance of inclusion in clinical research to overcome COVID-19. And the REDX initiative is a joint collaboration between Emory University, Georgia Tech, through the Georgia Center for Diabetes Translational Research to support research to better understand COVID testing patterns and opportunities for people affected by diabetes. Next slide, please. Our next steps after this webinar are to hire and onboard and train CHWs and to begin the Community Bridges capacity building program with CBOs. So thank you. I'll hand it back to the NACHW team and I'll be available for questions at the end of the webinar. Thank you.
Thank you so much to Brittany and Arletha for spending time with us. I've been monitoring the chat. A couple of questions are coming in. I just want to acknowledge a great deal of information we are sharing today, but this is the beginning of a multi-year engagement and building of partnership and infrastructure to mitigate the impacts of COVID-19. So if you don't get your question answered today, know that we're collecting those questions through the chat, and together with this team, we'll be able to share not only the slides, but our responses and links to information to all of the registrants. So I appreciate you bearing with us as we go through this information. Next slide, please. Thank you so much. I'm just waiting for that to load. So I wanted to make sure everyone could see it. You know, we had several hundred people register today, and over 140 were community health workers. They identified as CHWs. I'm really celebrating that right now. And so I'm not going to spend too much time really speaking about who we are, but I invite you to visit NACHW's website and to reach out to many of the CHWs here if you are an ally and are still learning about our roles, our competencies, and ways that we can be integrated into COVID-19 response. You know, whether CHWs are conducting street outreach to promote community violence prevention, whether we are helping immigrants and refugees navigate new healthcare systems and access care, whether we are on the front lines of immunization, training our mentors and peers and developing capacity building programs, or whether we're working at the state level, driving policy that promotes and protects our workforce. Community health workers, as APHA has identified, are frontline public health workers whose shared experience and trusting relationships facilitates our ability to be a liaison, a partner, an accompaniment alongside of individuals, families, and communities to provide compassionate service, to help coordinate and navigate across medical systems, behavioral health systems, social needs systems, which are often siloed. We are improving whole health and well-being and can stand on at least 6 decades of research in the United States of our efficacy in health disparities and driving equity. But we are not only downstream actors, we are also impacting systems and driving equity upstream. Next slide, please. Thank you, Aurora. Here, I just want to emphasize that as we speak about this workforce and our critical roles and our competencies in supporting strengthening of the public health infrastructure and mitigating the impact of COVID, I also want to identify that community health workers are also a precarious workforce. We are disproportionately female and females of color. We are peers, neighbors, survivors of rare chronic disease. Our lived experience includes lived experience with HIV/AIDS, lived experience from the reentry community, lived experience with diabetes and heart disease and stroke. And so often that can put us as a general workforce at increased risk during this pandemic. We are also a precarious workforce because of the way that we're funded and who we serve. We're often responding to historic and systemic disparity and inequity across silos. And our funding is often short-term and grant supported, which means there's a lack of sustainability, not only in the interventions against those disparities, but in the continuity of service to really achieve population health. We are working in communities, we're living and serving in communities which experience barriers of all kinds, technological barriers, literacy barriers, transportation barriers, financial barriers. And so we continue to bridge across cultures, provide health education. We are doing contact tracing. We're involved right now in community capacity building and advocacy and research work across the country. And I just want to acknowledge each of you as a CHW, your role before COVID and the ways in which you have begun to adapt and innovate while also living perhaps as a precarious worker in this time. Next slide, please. So I'm going to spend just a moment or two giving a level set on some of the ways that the National Association has been amplifying CHW roles during COVID. That's perfect, Aurora, right there. This is a very big slide, and I'm not going to read it if any of you got concerned that I would. But when we send out this slide deck, I just want to communicate to you that, you know, as I mentioned in my opening statement, NACHW, we were founded in April 2019. And I came on as the first ED in November 2019. So this organization is about 1.5 years old, while there were 6 or 7 years of organizing and planning with CHWs and allies to bring this organization to its launch. And so NACHW, we have grown up in large measure in the context of this pandemic. In early March, our members started to share with us their information, their resource, and their self-care needs from across the country. And our membership has grown as people have been searching not only for information and support, but opportunities to mentor, to innovate together, and to support one another during this time. So I offer this slide to you. You're going to find many hyperlinks on it that help you understand the messaging that we have shared with our members and our partners, CHW networks and associations across the country to articulate CHW roles during the pandemic, the website that we have curated since March 16th to try and pull together content that is specific to the roles of CHWs in the pandemic, the ways in which we've shared insights from CHW leaders across the country on the impact the pandemic is having to their personal and their professional lives. And then finally, at the very bottom, you'll see something highlighted and in bold. we are preparing, as part of our partnership with the Morehouse School of Medicine, a field guide for community health workers to orient them to all of the tools and resources and capacity building offerings as part of the Morehouse COVID Resiliency Network. So look for that resource as well as the other resources on our website. Next slide, please. Fantastic. So I want to thank, you'll meet in a moment our staff member, Aurora Grant Wingate. So right now, perhaps you're wondering who I'm referring to, but in preparation for the webinar, she collected the registrant information, and here you can see 141 CHWs registered. We know that that is a large umbrella term and that you're serving under many titles and different roles. You may also identify as a promotora de salud or community health representative, and we thank you so much for joining. Want to also acknowledge all of our allies, those who are working in public health, primary care, in research, in advocacy. Thank you for joining us today. Next slide. Of the registrants who responded to this question about, sort of who or what is your organization, we had 306 responses to this question, and you can see that the majority of respondents were community-based. And this is aligned with what NACHW's membership says, that the majority of our CHWs who are employed by organizations are employed by community-based organizations. And I want to acknowledge the critical role that they play in providing an infrastructure and support to CHW roles during this time. Next slide. Okay, so we were asking if people who registered are already connected to the initiative that Brittany laid out so well and that Arthea expounded on in terms of the way in which it's integrating the role of CHWs. You can see that the majority of people who responded, of 280 responses, most of you are saying, I am not yet connected to this NCERN work. And so we're really excited that you pressed your way to this call today. If you feel like we don't know enough about you, feel free to put your contact name and information and email into the chat, but we will be reaching out to all of the registrants to make sure that you have, as Arletha and Brittany shared, the website so that you can sign up directly and begin communicating and downloading resources and getting push notifications directly from the Morehouse NCERN project. Next slide. Okay, and NACHW, we're almost done with our portion of the presentation. I want to share here that slide is just fine. I want to share here that, as Arletha mentioned earlier, as part of our strategic partnership, NACHW spent the last 2 months developing an environmental scan. The purpose really was to help define the roles and capacity of CHWs and our networks, associations, and coalitions within the NCERN focus or priority areas. And you saw that slide earlier, so I won't name those locations across the country. But so our work is very focused. We wanted to understand COVID's impact in those priority areas that Morehouse and the Office of Minority Health have identified. And through a series of engagements, which one of my first partners, Jane Berry, is going to come forward and share, we wanted to articulate recommendations that came directly from CHWs or locally sourced from community organizations and actors and influencers. In this way, we hope to support Morehouse in building trust, in increasing access, and ensuring equity within these focus areas where we're going to be partnering. So I want to bring forward now Jane Berry. Jane has been a tireless intern for NACHW since June. And I want to just highlight her expertise and thank her for serving and for diving deep into this project. Jane, if you could share with us some of the methods and some of your work on this project.
Thank you so much, Denise, for that lovely introduction. I really appreciate it. And thank you, everyone, for joining us. So yes, as Denise mentioned, we utilized two basic avenues to put together this environmental scan. One part of those was conducting listening sessions with CHWs, with their networks, with their allies, and other key stakeholders in order to understand what they've been going through during this time, what their engagement has looked like during this time. And then the other half of the environmental scan was analyzing data like census data, county health rankings, and others, which I'll go into on the next slide, in order to understand better the COVID-19 landscape in the priority communities. And then we used both of those two avenues, put them together, and based our recommendations from those two methods and aligned them according to the objectives of the NCRN project. Next slide, please, Aurora. Thank you. So as I mentioned on the previous slide for the scan, we utilized several tools, including US Census data, the Social Vulnerability Index, which is put together by the CDC, and is essentially a way to rank counties in the US according to how vulnerable they would be to environmental disasters, health disasters, things along the lines of COVID-19. And then county health rankings, which utilizes public health data to rank every county in the United States according to health factors and health outcomes. So we utilized all three of those along with COVID information, COVID rates, COVID deaths, particularly COVID deaths according to race and ethnic minorities in the NCRN focus areas to try to understand which of the areas, which of the priority communities would be the most vulnerable to something like COVID-19. And then that was used for our understanding of the COVID-19 landscape. And then for the other purpose, for understanding what the CHW workforce looked like, we utilized other methods and other tools to understand the workforce capacity and how CHWs are being integrated within COVID response efforts. And then finally, we put this together by using the Mapping the New Politics of Care project, which is relatively new. It's a project that uses the idea of employing 1 million new CHWs and then deploying them across the US according to things like the Social Vulnerability Index, things like COVID-19 rates, to try to determine which areas have the most need for CHWs and how those CHWs can be best deployed during this time to try to approach the problems that are coming out of COVID-19. So our key findings were organized by national findings and then findings specific to priority communities. Our biggest national findings were that the CHW workforce is incredibly diverse, diverse both in name and role, and also in how they are being engaged during this time and where they're being engaged. And that diversity is a strength for sure, but it also leads to the second large finding of ours, which was that they lack a general professional identity, which makes it difficult for local health departments, for public health officials to understand how to best engage CHWs during this time. So that was something that we were trying to address through something like this scan. We also found, looking at COVID rates and COVID death patterns, that I think as everyone on this call knows by now, racial and ethnic minorities are facing a grave undue burden of COVID-19 rates and deaths in this country. And that was particularly true in all of the priority communities we looked at. Something that especially jumped out was that Native Hawaiian and Pacific Islanders in every priority community where their specific population was being tracked, they had either the highest or second highest rates of COVID-19 cases and deaths per capita. So that was something that we particularly wanted to focus on. And then finally, nationally, we also looked at county health rankings and found that in general, unemployment rates and uninsured populations were very high in all of the priority communities. And that was prior to COVID. So we're guessing that a lot of that has been exacerbated since then. And also that low birth weight was something that really jumped out as something that was true across all priority communities, and emphasizes that there is a large health disparity because low birth weight tends to be something that indicates greater health disparity, and particularly greater health disparities according to race and ethnicity. And then within our priority communities, we looked at things like COVID-19 rates and response strategy, particularly because the CDC has recently asked all of the states in the US to put together a plan for vaccine distribution. So looking at that, looking at the CHW infrastructure and engagement in each priority community. So where are CHWs? Who are their employers? How are they being engaged within local and state public health apparati? What the workforce challenges and opportunities are. So how are they connected to state officials? Has there been a recent workforce study? Have there been recommendations for how they should be best engaged? Are there associations, coalitions, questions like that would really reflect how robust the CHW workforce is in a given community. And then finally, connecting to the Mapping the New Politics of Care project. So determining how, if there are going to be 1 million new CHWs deployed across the US, how would they be engaged in these communities? How are they going to be involved in the problems of these priority communities, and how best to integrate them fully and effectively during this time? And so we used all of those findings to put together some recommendations. That's all from me. I will now pass it on to my wonderful colleague, Aurora, who will tell you more about the listening sessions.
Thank you so much, Jane. Hello, everyone. My name is Aurora Grant-Wingate. I am NACHW's Member and Partner Engagement Coordinator, and I'm also working to help coordinate NACHW's efforts with the NCERN initiative. So the first kind of part of our environmental scan is everything that Jane just went over, and the other two parts are our listening sessions and our key informant interviews. The purpose of our listening sessions was really to get a feel of the CHWs and CHW networks and allies in these focus areas. So we filtered our membership and other partners and invited them to these listening sessions organized by state. At these listening sessions, there were note takers and a series of questions, along with a presentation of NCERN to get people's kind of initial thoughts and reactions around the initiative, and also some of their thoughts and reactions about COVID response more generally in their area. Yes, and then the key informant interviews kind of emerged out of the listening sessions. During the listening sessions and other research we were doing, different priority communities kind of emerged for us, and we wanted to get a deeper dive to make sure that we were being culturally sensitive and to move forward having a really deep understanding of these communities. And these are a list of the populations that we ended up having key informant interviews and extra research done about: Pacific Islanders, the Navajo Nation, the Hopi Nation, which is located in the middle of the Navajo Nation, migrant workers, recent Asian immigrants and refugees, the reentry community, and patient advocates. So these are sort of the three parts of our environmental scan. The first part is our executive summary, which has been released. I will be emailing that to you after this presentation, and is also linked in these slides. So that is ready to go. And next week, our entire environmental scan will be emailed out to you and on our website for review. So the kind of last part of our presentation is something that Arletha already mentioned, is the NACHW COVID-19 Community Engagement Liaisons, which we are contracting with in these priority areas. So that application is open now. There is a full job description available on our website, along with the application materials necessary. That link works. That will also be sent out to you after this presentation. So thank you so much. If you have any questions, feel free to email me or Denise, and please visit our website. If you have general questions, please email our info or look us up on Facebook and LinkedIn.
Thank you so much, Jane. Thank you so much, Aurora. I have shared in the chat the link to the executive summary. It just became live a few moments ago. So I've got to give another shout out to another one of our staff members, Bernadine Mafhugo. So that link is available. The full report is well over 65 pages. And so that full report is in its formatting and will be ready next week. But please feel free to begin clicking on, yes, the PowerPoint will be sent out after the webinar. I also want to mention that we are thinking about sharing the results of the report by state. just in case there are organizations working across the entire state. But we focused our organization of our research, our findings, and our recommendations by the NCERN priority areas. Thank you so much to all of the presenters. I see that some people are saying they need to sign off, and that is completely understandable. I also am going to begin looking in the chat box for questions. If you have a question, because we don't have a sort of hand raise option, it would be great if you could just put a hand clap and we can call on you. We have over 122 people, so we certainly don't want to have everyone unmute. But if you've got a question, go ahead and signify that by doing a hand clap, and I'd be happy to call on you.
I don't have a question, but I do want to, my name is Ruth. I work with the National Latino Behavioral Health Association.
Hi, Ruth.
And I just wanted, hi, as a former community health worker, promotora in my community, I want to thank you all for the efforts that you all are taking to ensure that the community has access to equitable resources. And we know that we tend to trust people that look like us. And so I really appreciate what you're all doing in ensuring that, we hire very cultural, with different cultural backgrounds, our community health workers. So, and also thank you. I see in the chat that you have all been very active in answering all of our questions as the webinar has been going. So I appreciate the engagement.
Thank you so much. And I just want to say, Ruth was one of the folks that we met with for our key informant interviews. And we were grateful to meet the National Latino Behavioral Health Network and your leadership and some of your other staff members. And one of the things that we didn't mention here, because there are so many things, is that we know, for instance, that there's such depth of expertise here, not only in existing COVID-19 strategies that you may have been doing through mutual aid, through an employer, through a faith-based organization, a cultural organization that you may want the Morehouse School of Medicine to be aware of. If we had more time to do listening sessions, we would have had the opportunity to collect more of those. You'll see some of those highlighted in the executive summary, but if you're already doing something on the ground in this geographic area or to support and protect a specific population, please reach out to the Morehouse School of Medicine so that they can strengthen that initiative with their resources, right, with their trainings. And connect you also back into their national coalitions and meetings so that you can inform this initiative. The second thing I want to say is that Ruth's organization also has some phenomenal trainings, and we attempted to lift up some of those examples in our report to say, let's build on the assets that have come out of community authentically. Let's use what the community already trusts and that which is created to reinforce and strengthen and nourish our own health beliefs, our own models. So again, if you are an organization, a CBO, and you train promotores, you train community health workers, you have resources that are vetted and translated, we want to hear from you and partner with you. I'm going to scan for additional questions. There are so many of you, I'm scanning page after page. So let's see. And Aurora, if you see questions in the chat that I'm not collecting, please let me know. Okay, I don't see any here. Thank you. Oh, you're welcome. I see. Thank you for this opportunity. I know it's been a long week. Some folks are saying I have another meeting. Thank you so much for your time. Yes, we will share all of these slides with each of you. Okay, so seeing no questions, I want to give you back 2 minutes of your time today. I want to say that I pray that all is well with you and your family and your community during this time. I want to say that I know this holiday season will be radically different than that we were doing last year this time. I want to acknowledge that folks have been pressing in like never before to serve, to give, to donate, to pray, to help, to build, to write, to create, to train, and that work is not in vain. And there's more work to do. So I just also pray that you lift up your self-care regimen. If you don't have a self-care regimen, that you look to support organizations and be nourished by your culture, by your faith, by your community, by your purpose, because we have a long road ahead of us, and each of you are valuable to community. I'm sending a shout out to Alex from El Sol. He's saying we have a lot of trainings. Wonderful, Alex. We're already connected. Arletha, Brittany, Jane, Aurora, and to everyone on the call, thank you so very much. Let's partner. Let us hear from you. We know you're doing great work. We know you have insight and expertise, and we cannot wait to connect with you in greater measure. Again, you'll get the slides very quickly. And when you do, you'll see all of our email addresses. Sign up for those push notifications from Morehouse. Go to their website. It takes just a moment. And then you'll be ready to start attending those meetings in January, becoming aware of their community capacity building program and that funding. Lastly, I want to say I shared the job description for NACHW in the chat. If you are a CHW, a promotora, a CHR, and you are serving, either employed or volunteering in one of those communities, we would love to see if you want to come on board with us to support this work. We're not taking you out of your community. You will continue to serve in your local community, but you provide infrastructure and connective tissue from the Morehouse Initiative and NACHW into your community. You may be a CBO that has a promotora working part-time and you think they might be an excellent fit for this job description. Please download that and share that information with us so that we can partner with you. All the best to you, everyone. Be safe.
Denise, Miss Denise, I'm
Hi, Karen.
sorry. My hat have a message for everyone real quick. Hold tight. Thanks. Thank you guys.
I
See y'all
couldn't
again.
have ended it any better. Thank you so much.
Thank you.
Everyone.
I ripped
Merry
it off
Christmas,
on my
happy
mate. I said
holidays.
you have to give me that.
Happy
Hey, Denise.
Bye-bye.